Welcome to our podcast, Advancing Health Equity Through Advocacy, Student Nurse Edition, where student nurse scholars are advancing health equity through the art of advocacy. As students and new nurses, advocating for patients and yourself can be difficult. Through this podcast series, our nursing student scholars will introduce you to experts and advocates in the field of nursing that can help highlight ways that you can make an impact on our maternal health crisis and on the health of the communities we serve.
Hi, everyone, and welcome to our podcast. I am your host, Alyssa Meza, a Bass Scholars Student Nurse at UTMB's School of Nursing. On this episode, we will be discussing nurse advocacy through policy. Today, we are joined by our guest, Dr. Jessica Peck. Dr. Peck, thank you so much for joining us today.
Thank you so much for having me.
To get started today, can you tell us a little bit about yourself and the work that you are currently doing in the advocacy space of nursing?
Sure. Well, I am a pediatric nurse practitioner. I'm also a professor of nursing at Baylor. And currently, I serve as the Region 6 Director for the American Association of Nurse Practitioners, although I've had a lot of other organizational advocacy roles through presidency as the National Association of Pediatric Nurse Practitioners and others. I'm also a mom of 4, and that really influences my desire and my worldview in advocacy. But right now, my greatest role as a nurse advocate is in anti-trafficking work. I worked with the Department of Health and Human Services to create a set of core competencies for health systems and healthcare professionals and academicians and researchers to respond to human trafficking by creating policies and protocols. And I have been in the halls of Congress, which I never saw coming, by the way, and in state governments helping to advise on federal and state policies that are being made. And Alyssa, that's where I am, but it's certainly not where I started, and I'm looking forward to having that conversation with you.
Wow. Well, based on all of that, you are definitely the perfect person to have this discussion with us about policy. So with that being said, our first question, can you describe to our listeners what health policy means to you and how you believe health policy affects patient care and patient outcomes?
Well, I've already shared with you, I teach health policy at Baylor, and as my students come in, I survey them on how they're feeling about learning about policy. And Alyssa, the most common word they use to describe their emotions is dread. I am dreading this course. And I think sometimes as nurses, we wear that almost as a badge of honor, that we don't want to get involved in policy, which we equate with politics. We just want to be involved in patient care. We're the most trusted profession, so we want to stay above all of that. But the important thing for every nurse to know is that policy drives practice. And if you're not at the table, then you're on the menu. So it's very important to have nursing voice. Policy also seems like something that is very dry and impersonal, but in fact, policy is very personal. Every nurse can think to a time where they may have been in a patient room where a patient couldn't get care because of the insurance policy, and all of a sudden not being able to get life-saving treatment. That is very, very personal. And so when I started in policy, I never saw myself as a policy advocate. I started as an associate degree nurse, a very timid student who began to progress through education. And when I got to my doctoral degree, I took a health policy course, and my faculty wanted me to publish a paper. I looked around the room thinking, me? Oh, wait, she's talking to me. And I recognized that out of sheer fear, I needed to submit it. And it was published. And through that, I started to get invitations. And I did something really important. I had the courage to say yes, even though I was still afraid. And so I started sitting at policy tables. And through that, I was invited to be a Nurse in Washington scholar, an advocacy scholar for the National Association of Pediatric Nurse Practitioners. I was assigned to meet our senator from Texas, Senator Ted Cruz, right after his green eggs and ham debut that made him famous. And I was so intimidated walking into that room. But as the senator walked in, I started to notice little things, just like nurses do. I started to assess assess him, frankly. And what I saw was that his pants were very wrinkled across the knees, like they had been on a hanger. And the thought struck me, this is just a man who puts his pants on one leg at a time. And he may know about how Washington works, and he may know about being a senator, but he did not know a thing about nursing. And that was my job, to tell him that and to be an advocate for my profession and for my patients.
That's great. I love that story about Senator Ted Cruz. I also love that you said policy is personal, and you encourage people to say yes to things that they might not be comfortable with. So to expand on that, why should nursing students or new nurses understand the influence that policy also has on the nursing profession?
As a profession, we tend to undervalue our voice as nursing. I'll give you an example of this. Right at the onset of COVID, I actually had a tweet that went viral. It was really silly. It was a nasopharyngeal swab going to the back of your throat, a little cartoon graphic. And I said, this is how far back we have to put the swab for COVID. You might want to stay home. It was so silly, but it went everywhere. Like my 5th grade teacher is contacting me saying, I saw this tweet. And because of that, I was invited to be in a press conference. It was 5 medical professionals, mostly physicians, and me as the only nurse. And they were talking about really important things in the fight against COVID, but very technical things. We're talking microassay and, different microbiological levels of fighting the virus. And I was sitting there listening to that. And when it got to me, they said, what do you have to add to this conversation? And I said, these things are really important to talk about, but I think the average person is sitting at home thinking, so should I wear a mask? Can I go to the grocery store? Am I going to harm my grandmother by visiting? And you know what happened, Alyssa? In the chat, immediately, criticism. Who invited this stupid nurse? She cannot keep up with the conversation. This is pointless. This is useless. And, I think earlier in my career that might have crushed me. But in that moment, I recognized just because I have a different perspective does not make my voice less valuable at this table. And it takes us working together as a team. Yes, it takes the things on the microbiological level, but it also takes translation to the public. And so I think that's really important. And another example that we can give in advanced practice nursing is full practice authority. A lot of my graduate students don't realize when they come into my course that only about half of them are going to be able to practice without any restrictions or having to pay a physician for a delegation agreement for full practice authority. And when they start to realize the inequity, they think, so just because you live in New Mexico and I live in Texas, that's going to make our practice completely different? That's not right. And that's my job to come in and say, you're right. That is not right. And let's use our voices to make a difference.
Yes. So I agree with you that the voice is very critical, especially for a new nurse or a nursing student who might not have found their voice yet. So as you know, and as you mentioned, getting involved in health policy can be very overwhelming, specifically for a new nurse. So what advice do you have on where do you get started? How do you start becoming knowledgeable and involved and informed with health policy?
Well, the first thing that you have to realize is that there are different engagements and different life seasons. So there may be some times where you can give a lot and sometimes where you can just give a little, and that is okay. You also have to give yourself grace and space for the journey. That starts with valuing your voice, recognizing that you have something important to contribute, even as a student. For me as a faculty, I don't have the perspective of a student. I'm not walking in your shoes. I'm walking beside you, but I may not see or feel the same things you do. So even as a student, you have something valuable to contribute. The second thing I would encourage people to do is to join a professional organization. There are so many times where we will see people later in their careers be able to serve in an elected position or lead a committee, and then you start to look back and realize, oh my gosh, this organization was there for me before I even knew I needed it. And just having your membership to say we have your voice, we are representing you, and to have that money that we need to run an organization and to have staff and to have offices, we can advocate on your behalf even when you can't do that yet. And the third thing I would say is to get to know your legislators. All politics is local, and so much health policy is directed by your local representative, who may be a car insurance salesman or, an oil person or something that's completely unrelated to health. And they need your voice. Nursing is the most trusted profession, and they want to hear from you. You automatically have credibility walking into the room, knowing that you're a nurse. So that is where I would start.
Well, thank you. That's great advice. I'm definitely going to keep that in my back pocket. So with that being said, what suggestions do you have to prepare nurses who wish to speak about policy with these stakeholders, with legislative leaders and policymakers?
Well, you have to remember, again, that you are the expert in nursing. So just by nature of your education and your clinical experience, you have knowledge to speak to expert stakeholders. Also, being involved in a professional organization helps you to stay abreast of policy issues that are impacting you. So when you get an email from the professional organization, read it, because they'll tell you there's a law that's coming that will impact your ability to do this. And most professional organizations have advocacy centers where you can just get online, and they make it so easy. Literally in 30 seconds, you can click a couple of boxes and send a letter to your legislator that says, I want this bill, or this bill could be harmful. If you don't know what to say, they give you templated language, although as you grow and you learn more, you can personalize that. We have to remember that our legislators work for us. As the constituent, we are their boss, and they do answer to us. And thinking about how many nurses they may represent, that is going to be an important thing to them. And the last thing is that it's important to tell your story. It's easy to walk in. We feel like somehow, even now when I make legislative visits, that we have to go in there and razzle-dazzle everyone with a list of statistics and facts, and that we have to know everything, when really they just want to hear our story. They want to hear about the patient with diabetes that my colleague is caring for in a rural county who can't get diabetic shoes. And in order to get diabetic shoes, would have to drive 2 hours and take off of work and see a physician who would then assume that the totality of his care, he would not be able to see his nurse practitioner anymore. And so forced to choose between diabetic shoes or a nurse practitioner, he's going to choose the nurse practitioner. Those are the stories that they want to hear. And so if all else fails, just tell your story.
Mm-hmm. Well, that's funny that you say that, because I would kind of like to hear your story about how you originally got involved in health policy. I know you spoke about your paper that you wrote, and how you feel that the nursing perspective enriched the narrative or the outcome of the policy initiative that you were involved with.
So let me give you an example how I got started as an anti-trafficking advocate. Because nurses are a trusted profession and a trusted voice, I actually had the director of an anti-trafficking advocacy center call me and asked me to help write continuing education for nurses. My exact response to her, and I quote, was, absolutely not. No, I don't know anything about human trafficking. But what she told me was that people that she was working with in her organization had all seen healthcare providers and had no intervention at all. I tried to find an expert, a nurse expert on human trafficking, but I couldn't find one either. This is nearly a decade ago. And so I started by saying, all right, I don't know about trafficking, but I do know about educating nurses. So give me the information and I'll help you format it. And then when I realized the extent of the problem, even in my own backyard, I told her, I'm asking you the wrong question. I'm saying, how can I help you? When the right question is, how can I not help you? And so through that, I did write the continuing education program. We trained a speakers bureau of 22 to go through the state in Texas. And then I was working at the National Association of Pediatric Nurse Practitioners as the secretary. Through just kind of an organic grassroots effort, we ended up taking that issue as our own, seeing that that was a problem nationally and that nursing was not at the table. So we started NAPNAP Partners for Vulnerable Youth and the Alliance for Children in Trafficking. Through that, we were asked to participate in federal government, so I served as an expert consultant to the Senate. And then we started to look at states and see that we needed advocacy for education, mandated education, but with standards. And so I had actually a Democratic representative from El Paso contact me and say, I'm going to do a bill for mandated education. I said, that's not going to be popular. Most organizations are against mandated education. And he said, I'm doing it with or without you. And I said, well, then I guess you're doing it with me because I would prefer that. And we started to write House Bill 2059 in Texas. But because of the influence of nursing, the bill sailed through quite unexpectedly. We had a Republican senator from Houston who agreed to co-sponsor the bill. So it was a beautiful example of bipartisanship, which I think nurses excel at. And I actually was the only person who testified in support of the bill. But that was enough. My singular nursing voice, not the voice of Jessica Peck, but the voice of a nurse advocate saying, this is a problem. It led to the successful passage of House Bill 2059 in Texas. And now we have hundreds of thousands of care providers who are taking education to respond to trafficking, all because of the voice of one nurse.
That's incredible. That's really, I mean, I don't even have words. It's so incredible. So with that being said, you're an author, you're a mom, you're an advocate, you're a health professional. What motivates you to continue pursuing your passions in the health policy and the nursing advocacy space? And what are some tips that you have for new nurses to translate their motivation into their own practice?
Well, my own personal motivation is kids. Always and only kids, everything children. I've always been in pediatrics and I have 4 children of my own. And so the opportunity to make the world a better place for children is enough to get me out of bed every morning with a skip in my step and a smile on my face and a determination to keep knocking on doors until they open. The advice that I would give to nurses in finding your passion, because every nurse has something that they're passionate about. I've learned so much from my health policy students that I didn't know about before. I've learned about the effects of surgical smoke in the operating room. I had no idea. I didn't know anything about that. But whatever your passion is, I want to tell everyone who's listening 3 things. First of all, your voice matters. What you have to say matters. Your experience is important and valuable, and so you need to know the value of your own voice. Second, raise your hand and say yes. When they ask for volunteers, that means you. If you're a professional nurse, you have the qualifications and experience necessary to be a voice of advocacy for nursing. And the third thing I would say is to be your own best advocate. Nursing is a grueling profession. We take a lot on ourselves. We may advocate for our patients to have access to food, and then we brag about how we went 12 hours without eating a thing or going to the bathroom. So we need to make sure to treat ourselves as our own best patients and to advocate for ourselves, whether that's for safe working conditions or fair wages or, whatever it is that we need to do, access to mental health services. We need to be our own best advocates as nurses.
Well, thank you for those tips and tricks. I'm sure everyone's going to use those. So as we close, I know you recently published a book that stems from your life's work in pediatric nursing, as well as being a mother to 4 teens, like you said. Can you share a little bit about your book and how it also inspires parents to advocate for their children?
Well, as I became a mom of 4 teens, I had a lot of struggle because my oldest became 13, and I thought, here I am, a pediatric nurse practitioner. I'm supposed to know how to advocate for children, but I kind of felt like I was failing personally as a mom. And when I went to go look for parenting books, I did not see any nursing voices. I saw physicians, I saw psychologists, I saw parents, but I did not see nurses. And I thought, we are the most trusted profession. So I want to be clear, I didn't write a book because I have it all together and I'm such an expert. I really wrote a book because I found the courage to say, I don't. And I feel like looking at that as that voice of advocacy, that was an important perspective that parents need, because all parents want to be advocates for their teens. And of course, as a nurse, I see everything through the lens of holistic health: social, emotional, spiritual, academic, relational, physical, mental, all of those things. And so that really led me to a very unlikely journey of writing Behind Closed Doors, a guide for parents and teens to navigate through life's toughest issues. And I hope that it uses my nursing voice to empower parents as advocates for their kids.
Awesome. Well, thank you so much, Dr. Peck, for sharing your thoughts and your ideas related to this crucial topic of nurse advocacy through policy. We appreciate you sharing your time and your expertise with us, and we hope this inspires nurses and future nurses to find their space in advocacy.
Thank you so much for having me, and thank you for all of the amazing work that you're doing on this podcast and everything through your scholarship program at UTMB. I am really proud to be an alumni for sure.
Thank you. For all of our listeners, please join us for our next episode, Maternal Health Inequities, Why It Matters, as we interview our guest, Dr. Latia Hickerson from University of Texas Medical Branch, School of Nursing, who is a nurse practitioner, assistant professor, and health practice entrepreneur.
Until next time, remember, you too can have a seat at the table and be the voice of change for mothers, babies, and our community now. The views and opinions expressed on our podcast are not necessarily the views of the University of Texas Medical Branch at Galveston Health System or the UTMB School of Nursing.